Hello, I'm Rhode, and this is Hoofbeat News.
Good morning, FMHS. Today is Monday.
As you can see, this isn't the Hoofbeat News studio. We have decided that we are going to continue to broadcast at home during this continuing coronavirus crisis. To start us off, Akacia Schauermann decided to talk to some medical professionals to learn how their jobs have changed since the outbreak of COVID-19.
A lot has changed recently since the COVID-19 outbreak. One of the most affected professions has been those working in the medical field. I spoke with local medical professionals to gain their perspectives on this pandemic.
My name is Travis Freeman, and I'm a paramedic. So my job normally consists of going to work and checking off the ambulances. We kind of hang out until we have a 911 call or until somebody needs us. So we've had a lot of changes for COVID. We've had a significant decrease in calls and call volume because people are staying at home and they kind of don't want to go to the hospital right now. And we're recommending that people stay at home and they contact their primary care physicians, and then they get treated over the phone through telemedicine or video medicine with their physicians. So we've had a decrease in calls, and it's changed in the fact that we can't wear our uniforms home. We aren't allowed to wear our uniforms into the station. So we have to change our clothes out in the ambulance bay and in our garage before we go into our living quarters. And it's kind of different for us. We have to, clean the ambulances and the station as soon as we come into work and disinfect everything and make sure it's clean and make sure that all of our equipment is still there, which we do every shift. But we've had changes with the layouts of the ambulances and getting masks and gowns and all that type of stuff on the ambulance. I think that everyone should definitely be listening to the recommendations of doctors, the physicians, the governor, president. Stay at home, washing your hands, making sure that you're safe, and I guess keeping other people safe too. Social distancing is super important, especially with COVID-19, because it is something that we don't necessarily know a whole lot about. And it's a new, if you will, disease that's affecting a lot of people, and there's not a vaccination or a vaccine yet for it. And so those recommendations are super important to listen to. Some positives that could definitely come from COVID-19 and the pandemic that's surrounding this is the way that healthcare is kind of looking at mass pandemics or something that affects a large amount of people at one time. If you look at the amounts of stockpiles and stuff that the states and the governments have, and the way that healthcare is kind of using those. I mean, right now we're having to reuse masks and reuse gowns and other types of equipment that we normally would dispose of. So here where I work, we work 72 hours at one time. So we work 3 days straight, and we're allotted 1 N95 mask for that entire 72 hours. And then like nurses, doctors, healthcare facilities that you go to, they're allowed 1 mask for their entire week. And so we just don't have the supplies or the stockpile to be able to use 1 mask per patient like we normally would. And I think that that's going to be super important. I think that going to your doctor and just getting a checkup is going to be something that you might see less of. And with the innovation of using the technology that we have and being able to talk to your doctor over the phone or through video conference call like we are now is going to be something that we'll see later on with being able to have doctor's appointments.
So I work at Brush Family Medicine. My name is Leslie, and I'm a medical assistant. So when you go to the doctor, the people that room you and take your vitals, do your shots, stuff like that, that's what I do. So, oh goodness. I do family medicine and OB. So mostly just patient care. I have to do with like refilling meds, administering medications, talking to pharmacies, ordering stuff for patients, drawing blood, stuff like that. It's like a normal day kind of thing. We see usually about 20 to 25 patients. Now it is very, very different. So what we're doing now is called e-visits, where I'll call them, get an email, schedule that, which is, we launched this program way too soon. Usually in healthcare, it takes months to roll something like this out, and we rolled it out in 48 hours. So that's been fun. Go Banner. But it's a lot different. I don't get to see my patients as much anymore. I went from seeing 25 a day to 7, and that's sometimes including. We're only allowing certain people to come in at certain hours. So first thing in the morning, I'm usually there at 6:30 till 5:30, depending on the day. And now the first part of the day is well visits. The second part will be sick visits. Usually they're all intermixed together, whatnot, but we're really trying hard to eliminate any possible contamination, cross-contamination, keeping people as healthy as we can, and protecting the young, like little babies from this, or our little cute old people too. We just want to make sure we're able to keep the sick away from the healthy patients. When it comes to work, it is very honestly hard to find positives, more than the fact that I'm excited to get back to my normal routine. I had some time to catch up on some random things, which is awesome, but I miss my patients, and I definitely miss not being terrified to go to work also. Like, I cannot wait for that part to be over. Wash your freaking hands. Stay at home. Take it super seriously on the stay at home part. I still see people like on Snapchat and Facebook hanging out in large groups. And I can tell you right now, the majority of people we thought would be COVID negative or COVID positive. I had a patient die on Monday, and we sent her, she's old, she's like 90, but she ended up having COVID, and we had no freaking idea in clinic. Nobody is safe. Nobody is, just because you're unsymptomatic and you're feeling fine does not mean you are fine. We really take it seriously. Take those precautions seriously. Wash your hands. You may recover from this just fine, but my 65, 75-year-old patients probably will not. So just keep that into consideration. Wash your hands, keep your distance, and follow the distancing rules. Still go to the grocery store, get your food, do what you need to do there. Just be cautious.
Hi, my name is Allie Howe, and I am the Director of Client Health Services at the Northeast Colorado Health Department. That's a lot of words, but essentially it means that I help coordinate our health education and our clinical outreach here at the health department. So we've had to shift really quickly to continue our normal public health services and also be able to manage our incident response. So we have coordinated with all the other emergency response, sheriff's departments, police departments, cities and towns across our whole region to make sure we are all working together. As a public health professional, I would hope that everyone is not just thinking about themselves, but thinking about everyone that they love. So who we love in our community, it's not just our best friends, it's not just our family, but it's our favorite teachers, it's our favorite someone that we might play a sport with, someone we act with. The healthiest of us, we're not going to have a big problem with COVID-19, and we can definitely carry the virus but not have any symptoms and still be carrying that around with us. So what I want everyone to think about is just who do you love and who do you care about? Who do you want to keep healthy? And that should direct all of your behaviors. Because it sucks right now. All of our lives have changed so much, and it's hard. It is so hard And the only way that we can, the best way, the most productive way for us to cope right now is to think about those we love and then do exactly what the experts ask us to do. You see the strength of a community when we rise to this challenge with a good attitude, and I've seen that definitely in Morgan County.
So my name is Uriah, and I'm an x-ray tech, and I do the images, anything from chest x-rays to if you break your bone on your leg or something. That's kind of what I do. In a typical day, I would, depending on the patient, I would do x-rays of their chest if they're having some coughing issues or just something doesn't feel right, or if someone gets injured, go ahead and I take pictures of those areas just to see what's going on with them. Well, definitely our numbers went down. People are kind of not coming in as often as they usually do, which in a way it's really good because if they don't need to be in the hospital or clinic or wherever, they're not exposing themselves. But now we have to kind of be more vigilant of who are we x-raying and what procedures need to be done and sort of those things. Well, now I have to go to work and I get screened at the door to make sure we don't have fevers. And we have to do that throughout our shift, which about every 4 hours. I think positive, it's going to help us help each other out, especially right now because we can't help our small businesses as much as we can, as we usually are. Maybe after this, we're going to help them more, go shopping locally, just to help them come back up to their normal volumes as before.
So I'm Dr. Amy Prince, and I'm a pediatrician here in Morgan County. So normally I see kids anywhere from 0 to 20 or so, and I treat kid problems. So I see a lot of well childs, and I will make sure that the kids are vaccinated and that they, filling out school physicals and doing all the normal keeping them healthy stuff. We have like an obesity prevention program that me and my nurse are running. And then I also see sick kids that are in the ER, also kids that need to come in the hospital, and a lot of newborns that are born up on the OB floor. I'll go take care of them, do some circumcisions. And so it's just kind of some of everything. It is still rapidly evolving. We have initially, a couple weeks ago, we started trying to see only well patients, separating our well visits and our sick visits. So we would see well children visits from 7 to 9 a.m. and then only sick kids after that. Unfortunately, there's no symptoms that are unique to COVID. It does overlap a lot with flu. So a lot of people have generalized malaise, like not feeling well, their muscles kind of hurt, and then the upper respiratory symptoms. So stuffy nose, runny nose, a little bit of a cough. You can have some headache, and then shortness of breath. And then you can, usually towards the end of the illness, which can be 1 to 2 weeks, you can get some GI symptoms. So people are even having some nausea and vomiting. And then, of course, fever. But only about half of the COVID patients are getting the fever. Colorado is hitting the surge. So it'll be this week and next. So we're kind of preparing. And I actually work part-time for the military, too. So we're also preparing in the military to get deployed to kind of fight the virus and set up hospitals that'll help offset the surge at our major hospitals in Denver and, other big cities or, other areas all across Colorado. So I'll probably have to go and help with the COVID pandemic with the military here in the next week or two, because they expect the number of cases to increase for probably another 7 days. And then after that, hopefully we will have peaked, and then it will kind of start ebbing slowly. So really stay home in your house. You go out only for groceries or emergencies. I know the recommendation and the mandate in a lot of cities across the US now is to wear a mask. That's not because they found that the virus is airborne. That's still just to prevent you from touching your face. So I personally do not. I don't think it's a bad idea to go ahead and wear a mask if you're going out. It just reminds you to not touch your face. And if you do have to go out, because now we have the outbreak at Cargill and Ebenezer and, even Leprino. If you go out, so it's out there, it's everywhere. So if you do have to go out, bring some hand sanitizer. If you touch anything, sanitize your hands immediately. Don't shake anybody's hand, don't hug anybody. Try to maintain the 6 foot distance between people, and you should be okay.
A big thank you from Hoofbeat News to all of the medical professionals who work hard every day to make sure that we stay safe. Up next, Dylan will share some advice for what to do when boredom hits while you're stuck at home.
Nobody's allowed to go outside, so here's some ways to keep yourself entertained during lockdown. Play with your dog. Or cat if you have one of those. Just watch Criminal Minds. Go outside and build a snowman in April. Watch YouTube tutorials about stuff. Stare at the ceiling and think about life. Is Tony Hawk still alive? Learn a new recipe and cook something. Watch more Criminal Minds. Talk to your friends on FaceTime or something.
Hey.
Hi.
So, what you been doing during this whole lockdown thing?
Making TikTok dances and playing games, reading, painting, taking naps, eating, and watching High School, the musical, the series.
Dude, you should give me your Disney Plus password, please.
As you can see, there's a lot that you can do to keep yourself entertained even while you're stuck at home. Uriah is bringing you a look at Noodles.
So, hi, I bought these noodles in trying to substitute from the original hot ones like all the YouTube videos you see. I guess I'm going to be reviewing them today. These are the noodles itself. Oh, just spilled that all over my keyboard. These noodles are called Shin Ramyum. Shin Ramyum. They're Oriental, obviously Korean. So I guess we're just gonna try them. They're supposed to be hot noodles. I was supposed to do a hot noodle challenge, but I couldn't find the original ones. We're just gonna try them. Wow, they're actually kind of hot. Okay, I guess we can just eat them as fast as we can now, right? I mean, you definitely taste the Oriental seasoning in them. You get a packet of the seasoning itself, and then you get a packet full of, like, lettuce? What is that? I don't understand what that is. Wow, my computer's messing up because of my keyboard. Oh, geez, please don't mess up.
My mouth is still kind of hot from tasting them at first. I mean, I spent about 10 minutes trying to fix my keyboard, which is broken now. So, you know, I'm not the happiest camper right now, but I'll eat some more noodles for everybody at school. I mean, not that you guys care or anything. It's just sophomore eating noodles, you know, like. I mean, what do I have to say for them? They're hot. They get hot. They definitely do get hot. The noodle quality itself, it's pretty good. It's noodles. The back of the packet, if you want softer noodles, you put them in for 5 minutes, and if you want al dente noodles, you put them in for 4 minutes. I don't even. Okay, first con I see of these are hurting my stomach. These are making my eyes sweat. Woo! I'd recommend them. Yeah, 8 out of 10. That's what I would give them. The noodles are good. The seasoning's good. The stuff that's in them, it's pretty good. They're Oriental noodles. They're ramen noodles. What else can you say about it?
Thanks, Uriah. I hope that you have enjoyed this episode of Hoofbeat News. As always, if you have any ideas for stories, make sure to let us know. From all of us at Hoofbeat News, have a great week, FMHS, and stay safe. Even though we're not at school, the Hoofbeat News team is still looking forward to next year. As this year comes to a close, we're looking for new people, especially incoming juniors, who are interested in Hoofbeat News. If you have any interest whatsoever in joining Hoofbeat, make sure to contact Mrs. Larson and ask her about becoming part of the team. We'd love to have you on board, and it will be a great experience.